Okay, ladies and gentlemen, thank you for your patience. I think we'll try and get things underway. I'd like to welcome you all and thank you all for coming. And just quickly thank our sponsors, the Nelson Daily News, Western Auto Records, the Civic Theatre, for making the theater available. Doug Harrison's at Harry Productions for the sound. Kootenay Co-op Radio, they're broadcasting simulcast live as well. So hello to all the Kootenay Co-op Radio listeners and the Heritage Inn. Thank you. My name is Drew Edwards, and I'm the managing editor of the Nelson Daily News and your host for this evening. I'd like to take the opportunity to introduce our panel. Immediately to my left here is Glenn Sutherland. To his left, Peter Lee, who is chair of the Kootenay Lake Hospital Foundation. To his left, Rick Riley, chief operating officer of the Kootenay Boundary Health Services area. To his left, Dr. Jim Noiles, who is a family physician here in town. And to his left, Dr. Phil Malpass, a specialist of internal medicine at Kootenay Lake Hospital. And a fan favorite. Now, unfortunately, the last member of our panel, MLA Blair Sufferedine, couldn't be here this evening. I do have a message from Mr. Sufferedine that he asked to be read at the meeting, and I'll read it now. Due to poor weather conditions, my flight from Victoria was forced to land in Vancouver earlier today, and I will be unable to attend tonight's meeting. I deeply regret not being able to address you tonight, as I was looking forward to hearing your comments and suggestions on how we can improve healthcare delivery in Nelson. I will be making my rounds upon my return tomorrow, meeting with organizers and stakeholders here tonight to ensure I have a clear understanding of what concerns the public may have so I can lobby hard on your behalf in Victoria. I look forward to future opportunities to address you so I can hear your concerns in person. I would like to remind everyone here tonight that my constituency office is always open and your comments are always welcome. Now, I'd just like to explain what we're going to do here tonight. There is going to be presentations from each member of the panel, and then we'll take questions from the floor. Now, during that period, when we do the questions, we'd like to ask that the questions be limited to 30 seconds. So you have 30 seconds to ask your question, just so that we can get as many possible questions answered in the time that we have allotted. And we also ask that people remain focused on healthcare. We know that there are a lot of other issues in the community that people are concerned about, but tonight is for health and healthcare alone, and so we'd like you to stay on that topic. And finally, although I know you're all well-behaved citizens, we'd just like to ask that everyone remain as courteous and polite as possible, and that we try and keep things civil and as positive as we can possibly be in this situation. So thank you very much. And with that, I'll turn things over to Glenn Sutherland.
Thanks, Drew. I want to thank everybody who has shown up here tonight. It indicates your true commitment to health care in our area. And as a community, it's going to be important that we not only come together tonight, but we come together as a whole region as we move forward, as they deliver the news about the future of healthcare delivery in the territory. The rules have changed. We now have the Kirby Commission, the Romanow Report, the Mazankowski Report, and even the Canadian Tax Federation has stepped up and shared their views. Within this, I'm going to share tonight with you some discussion points that we shared with Mr. Ramsden and Mr. Dolman when they were through in early January, and these will outline some of our concerns and hopefully some of the areas that they can address as they formulate a model for healthcare delivery in and around Nelson. 2 years ago, KPMG, International Consultant Agency for Tax and Accounting, was commissioned to identify how healthcare should be delivered in the Kootenays, in the West Kootenays. They identified that there should be a two-site model, and it's the accurate requirement for this area, and that specifically the Nelson component should be, as a minimum, it should support internal medicine, general surgery, and maternity services. Some of the issues that are very important to us tonight as we sit inside is that we service a huge geography, and we wanted to identify as a community what our minimum acceptable level of healthcare service delivery is. It was our view when we talked with Mr. Ramsden and Mr. Dolman that citizens will be unwilling to accept a level of service delivery that falls below that is which described in the KPMG report for a two-site model for the West Kootenay area. We believe that without these core services, our citizens will be put at serious risk with potential for loss of life. Further, the valued specialists that we have in Nelson advised us that they may not decide to work in other parts of the region. They may take up some of the many offers they have in their personal files. We have built up a tremendous amount of capacity at the hospital currently that's been developed over many years. It has to do with the talent of the people that are there and the number of services that we offer. If we lost our facilities and we lost some of these services, we would suffer from some permanent loss, and it would be very difficult to recover that capacity, especially when the regional facility is in a poor location in the province. It's in the corner, and can it adequately serve all of the residents in our area? We believe again that the two-site model is right for this area, and conversely the one-site model would result in an unacceptable level of patient care. Due to this harsh geographical constraints, and even tonight if you look outside at the weather, it would impede us utilizing a regional hospital to the highest efficiencies. In addition, the higher proportion of the population resides in this area, with Kootenay Lake Regional Hospital serving 36% of healthcare delivery, and it's forecasted for growth that's higher than other areas of the region. That being said, in discussions with Mr. Riley, he's made it very clear to us that this is not a Nelson-Castlegar Trail issue. This is a regional issue, and we have to pull together as a region to conserve the services that we offer as a region. The alternative to that is Kelowna. So I don't believe that any of us here want to lose any of the services in our region and have to travel to Kelowna. So it's important we pull together as well as a region and work together aggressively to find out solutions on how we can do that. Mr. Ramsden noted the minimal level of ambulance service training and qualification in some of the more remote areas of the province. And one of the things that he indicated he's going to try and do is to work to improve the ambulatory services within our region. Right now they're under provincial control, and it may make sense to move it to the Interior Health Authority. I think especially on tonight's, like tonight, you understand the value that these ambulance workers provide in these types of conditions. I know Mr. Riley, when he first came over and was dealt the deck of cards that he had to deal with, he set a process in place that was to work with all the physicians and all the healthcare workers in the region and define and identify the roles that they would play. And I think to the best of his ability, he's working with all the people to define what is going to be the best route for healthcare delivery as we move forward. One of the opportunities that we have for Nelson is that currently applications have been submitted as the Interior Health Authority is putting together a board of 8. That board of 8 will be 8 representatives from around the health authority that will help provide direction for the health authority on all issues. I think it's very important that we all support a Nelson representative on this board, as predominantly the management team that was designed in Trail is there and will be effective, but we'll have a lot more support at the board table. Mr. Ramsden walked through Kootenay Lake Regional Hospital. After several professional assessments, engineering firms, BCBC, and architectural assessments that have been conducted, they've outlined how poor that facility is in condition. And it was deemed to be in need of replacement. But Mr. Ramsden felt it would continue to serve a useful purpose in the short term and said that we would have to live with that facility for the short term. It is adequate, or it is clear, however, that our long-term care facility, Mount St. Francis, requires immediate replacement. Over the long term, Mr. Ramsden concluded a meeting suggesting that as a community we must pull together and define ways to immediately replace that facility. And if as a community we could do that and define a model that would work, the Interior Health Authority would do their best to start digging a hole and putting up that facility. Mr. Riley and the government has delivered a $136 million problem, of which $90 million has to be realized by April the 1st. Our component of that is 12%. Right now, the Conference Board of Canada says when it looks at the portion of government revenues that are directed towards health care, currently 38% is directed toward health care, and if nothing was done, it would move to 53% by the year 2020. There are stresses on health care. After our meeting, I was pleased to see in Transition News that they were going to proceed with what's called an acute care role review. And I'll read some of this. Many of the hospitals that have been functioning as full-service facilities, especially in the smaller communities, will see changes in the way they operate. Interior Health can no longer afford to run the acute care system in this way. In order to assess the roles and functions of acute care facilities in the Health Authority, administrators are conducting an acute care role review. This review will assess the role of each of the 32 hospitals in our Health Authority. The assessment will then take into account several factors. The population of the community and area. Ladies and gentlemen, our community is vibrant, it is growing, and we need a hospital. The utilization rates of our existing hospital, it's high. The beds we have are being used, and at times we are even into overflow. The number of healthcare providers in our community, we're proud to have the healthcare providers that we have. We're proud to have people like Dr. Malpass and the physicians that have chosen to live here and provide the healthcare services that they do. The geography that we service is huge. If you live in Caslow or Crawford Bay or New Denver, it's critical that you can access a facility that will save your life within an hour or sooner. It's important that our hospital services the north part of our region, and we hope they identify that as being important. The ambulance service in the distance to the next larger hospital. Again, if you live in the remote areas and you have to travel to Trail, that may be too far. Lastly, the physical status of the buildings and equipment. I'm sure the people that were here tonight were in the room when we looked at replacing the existing hospital facility in the Mount. It was identified as being functionally obsolete, and we want to see a new facility as we move forward. And we hope that everybody in this room doesn't forget that those facilities need to be replaced, and over the next number of years we have to strongly identify as a community that that's important and we need to get it done. Lastly, the community wants to retain control of the health campus lands that were originally dealt with by the Nelson Area Health Council. As a community, the Health Campus project provided significant operating and health services efficiencies. And for the government who's looking at efficiencies down the road, it's important that we identify ourselves as being the people that can identify efficiencies for rural BC, and they should look at our area to define how we can do health care better. As citizens, we need to develop a community wellness plan and evolve into a community that builds partnerships that connects all of its health resources for the betterment of its residents. We have to work aggressively with Selkirk College on education. We have to identify recreation. And it's easy because we live in a healthy environment. These are all components we control and that we can develop over time, and we can and will have the opportunity to lead the province in developing awareness in health and wellness issues and take a very proactive role in this area. Mr. Riley has been dealt a very difficult deck of cards, a tremendous challenge for our region. In our dealings with him, he has been very professional, forthright, honest, and in that capacity, he has done, in the timeline that he's been given, a tremendous job. And we have to work with Mr. Riley over the next period of time to define how we can improve health care with the cards that we've been dealt. And on behalf of the community, Mr. Riley, we do look forward to working with you. We look forward to working with the Health Authority, but we do feel that health care is important to our area. Thank you very much.
Thanks, Glenn. I'd now like to turn it over to Chief Operating Officer of the Kootenay Boundary Health Services Area, Mr. Rick Riley.
Thank you. It's good to be here. This is the second community meeting I've attended in the last 3 evenings, and it's always an interesting experience. I appreciate the remarks Glenn has made about my role. I am trying to work closely with the communities and the people that are involved with healthcare and have an interest in healthcare in each of the communities to ensure that they understand the issues that are upon us and can help me work with the corporation of or the Interior Health Authority in moving forward to meet those challenges. Just a bit about myself. I've worked in healthcare for 28 years. I've been a resident of the Rossland for the last 10. So I'm familiar with the issues in the Kootenay boundary. For a brief spell, I was CEO of the defunct Regional Health Board that was in place in the West Kootenay boundary back in 1995. So I have a long background in healthcare in our area. As I said, I've been in healthcare for 28 years, and I have to say I've never seen a change in healthcare and the philosophy of the province in providing healthcare in those years, as I now see, even including the time of the social credit. We have a conservative government that the province elected, and they have philosophies about social programs that are considerably different than governments that have preceded it. And they're very strong on the philosophy of accountability of people that work in the public sector for living within the funding provided to them. And that always hasn't happened in the past. They have a belief that individuals have responsibilities for their own health care and for caring for their families and for their seniors. And it isn't solely the responsibility of publicly funded health care system to provide everything or try to provide everything anymore. That's just one of the changes in philosophy in our province. They're also taking a business approach to health care. In a sense, the Interior Health Authority is a corporation now, almost a crown corporation. It's a considerable change from the way healthcare has been provided previously, where interested, concerned individuals in the community could be on healthcare boards such as health councils or hospital boards. The boards that are being now struck are being handpicked by the province to be composed of individuals with backgrounds in business. And people like myself are being held accountable by these boards, or will be, to live within budgets and to achieve results based on statistics, based on economic analysis, based on performance standards and guidelines, both clinical and financial. So December 12th was a major day, a major significant change day in BC when The 5 mega health regions were created, and the health councils and the former regional health boards were eliminated all on one day. We are part of the second largest health authority in BC. Our land mass is 20% of the province. We're part of a health authority that goes from the Alberta border right across the southern half of British Columbia, wraps around the Lower Mainland, and reaches the Pacific Ocean at Bella Coola. It includes the Thompson area, the Chilcotin, so it's very diverse. And we in Kootenay Boundary represent 12% of the people that live in this health authorities. And that's going to be one of our challenges. I think Glenn alluded to that a bit just previously. So the government has indicated that they will not cut health care, but that they're giving zero increases in our budgets for the next 3 years. And they are not, and even though there were collective agreements that were agreed or imposed that resulted in wage increases, that funding won't be provided to the health authorities. It'll have to be absorbed through efficiencies or changes in the system. There's also the need to absorb inflationary pressures and other things such as fuel and supplies, medical equipment supplies. We're also advised that possibly, that whatever is negotiated with physicians, or not negotiated, arbitrated with physicians, and the arbitration settlement should come out prior to the end of the fiscal year, that health will have to help fund that, whatever the increases are, out of the operating budgets of health authorities. There's no more money for health care. So what does this mean? It means initially the new health authorities have a major challenge. Our budget as a health authority is $930 million. Over 3 years we'll be short $136 million, assuming nothing changes. Assuming that all of the inflationary costs I outlined and others may have to be absorbed. The challenge is being met initially by administrative efficiencies and streamlining of support services, but it does not appear that that will be adequate, and that has then prompted movements to move forward to review how health services are being provided across the entire health authority. Every community's health services are being reviewed, and I should mention, because we're now part of a large corporation, there's individuals on the support staff in Kelowna with backgrounds in health planning and health economics, financial analysis, that are looking at all of the data that exists about healthcare available from the province, there's the CIHI data reflecting hospital performance, analyzing vital statistics data on population demographics. And they're comparing us to each community and saying that the Kootenay Boundary has actually been well funded over the years. And in fact, in comparison to a fast-growing region like the South Okanagan, is very favorably funded. This is going to be another one of the challenges as a health service area in the Kootenay Boundary we're going to have to face together. I think that what will affect all of us, will affect all of our facilities in every community to some degree. Every hospital facility and service is being reviewed, as I said. We'll need to look at how to direct our resources in the future to areas of greatest need. That means prioritizing how health care is provided in our communities. It's not going to be such that we have adequate resources for everything we now do. Just to outline the process, and Glenn touched on it, there is an acute care review underway. There's also a review of residential care and community programs underway. A compendium of information will be brought forward by mid-February, I'm hoping, to each community. And there will be information provided that indicates the performance of the healthcare system in the region or in the health service area and in each community. And there will be specific proposals for change that will be based on data that is based on a principle of equity across the system. Now, equity meaning that on a per capita basis, each area is funded equitably. This will be a challenge for us, as I indicated, in many of our healthcare services on a per capita basis. We're very well funded. In fact, in some instances, in some communities, the highest in the province for certain services. There will be an opportunity for review by communities to review the data and provide feedback into the process. And the process, though, is to identify and review, is the data correct? Are the assumptions underlying this correct, or are there oversights of how communities work, or how healthcare is delivered that need to be corrected and remedied? And is there other ways that the financial challenge could be met by doing things differently than will be proposed in these documents? Physicians will be involved, community leaders will be involved, interested stakeholders within the health system, the employee groups will be involved in having an opportunity to comment and give feedback. And I think there's two processes here. There's a political feedback process and there's the administrative process. My role is to interface and deal with the administrative feedback into the system and take the interests and concerns of the Kootenay boundary back to Kelowna, to the senior management team, and attempt to ensure that, given the circumstances, the best outcome results for the Kootenay boundary. Now, the situation is that, as I said, probably no community is going to be happy because of the nature of the financial challenge that we have with this outcome. And there may be, well, a separate political process that's ongoing at the same time. But I'm hopeful that you'll participate in the administrative process of reviewing the documents while that other process is ongoing. Well, Kootenay boundary is one of 4 health service areas, and I think you have to say that we're one of the smallest ones with only 12%. East Kootenays and Kootenay boundary are somewhat disadvantaged compared to Kelowna, compared to the South Okanagan and Thompson area in this. So I think we need to work together. Less competition between our individual communities and coming together to protect what we have for health services in the Kootenay boundary. I'm taking that as one of my responsibilities. I want to confirm tonight, though, that I know there's anxiety about a hospital in Nelson. There will be a hospital in Nelson. There will be There will be emergency care services in Nelson. What the question, which is part of the review process, is 1 hospital or 2 hospitals, and that issue is not settled. We're hoping that possibly that can be local dialogue on that issue. If there's, we want to preserve the services in the region. I think that's the priority. So my commitment is to work with you and the community groups, the physicians, in an open manner and provide the facts as I have them, and to take your concerns back into the administrative process. And I certainly will be monitoring the input from the community generally, both through the media and through, I'm sure there'll be subsequent meetings just like this in the near future. So I think we are in a time of very significant change. In order to get through it all, we're going to have to pull together. So thank you very much.
Thank you, Mr. Riley. Peter Lee is the chair of the Kootenay Lake Hospital Foundation. Peter?
Thanks, Drew. Thank you. When I look out here tonight, I'm trying to think, when was the last time we had a crowd this big in this facility? Was it Shrek? Was it Harry Potter? Or was it the last healthcare meeting we had? And I can tell you, I would rather be here watching the first two than the last one. But we find ourselves in this place once again. Once again, we're talking about the healthcare crisis in our community. Now, I want to talk to you tonight about a little bit about the Hospital Foundation and a little bit about what we need to do to get us through this crisis. But I can tell you one thing, the word defeat is not in my vocabulary, and it shouldn't be in yours either. The Kootenay Lake Hospital Foundation was formed in 1991, and at that time, it was a very passive organization that was formed to buy equipment for Kootenay Lake Regional Hospital. And in those days, ladies and gentlemen, there was a fair enough amount of funding provided by government for our healthcare system, as you probably know. The last 10 years or so, that's diminished to the point where the Hospital Foundation has had to provide core medical equipment. We've moved from providing enhancements for our medical practitioners to provide a better level of care to actually providing up to $500,000 a year, which is necessary to fund the core medical equipment. Well, back then, as I said, we were a passive organization, and we trusted the system to tell us what those priorities were. We learned very quickly that we could no longer be a passive organization in order to represent the donor's interest. We had to wade into the healthcare system, and in order to represent the donor's interest by getting best value for your hard-earned donations that you give to us, we had to become donor advocates and healthcare advocates. And so we have become that, and that's why we find ourselves in this place today, and that's why over the last couple of years we have been at the forefront together with these folks in front of me, beside me here, in furthering our health care situation. So over the last 10 years, through your efforts, we have given Kootenay Lake Hospital $1.8 million to fund equipment. We have set aside almost $1 million for a legacy fund to provide for future needs. And I want to thank you for that. So we have a big part, all of us, in ensuring that we continue to deliver quality health care in the West Kootenay, and that we enhance Kootenay Lake Regional Hospital and the Mount. So let's talk about this role, this healthcare roller coaster that we've been on in this community. You know, it was just less than a year ago that we were all celebrating our new facility, a $63 million project. And now we find ourselves today struggling to retain even a first aid station. It's incredible, ladies and gentlemen. That project represents a dynamic, innovative model for rural health care delivery. We all know that. It's been endorsed by the feds, it's been endorsed by healthcare professionals, it's been endorsed by everyone as an example that could stand for rural health care, a model for rural health care delivery in this nation. It shouldn't evaporate into the political ether just because there's been a change of government. So what I want to do now is I want to quickly give you some observations and some suggestions as to how we should be dealing with this healthcare crisis. First off, we must recognize that this project is on hold, but it hasn't been canceled. We can never assume that it will be canceled, because if we do, we're just resigning ourselves to a lower standard of health care than we deserve and that we expect. So we must be able to consider this healthcare crisis as a temporary one. And in order to adjudicate ourselves what this crisis means to us, when this role review is brought forward by Rick here, we're going to have to evaluate what that means. What are the implications of that for our community? And not only the Nelson community, but the West Kootenay boundary community. And as Glenn said, it's a good illustration tonight, if you're a family living in the Lardo, of how long it would take you to access healthcare services if you have to go beyond Nelson and maybe even beyond Trail to Kelowna. We can't accept that, ladies and gentlemen. We can't tolerate that. So we need to understand what is our bottom line, what, as Glenn mentioned, what is the community's bottom line minimal expectation to get us through the period of this financial crisis that we find ourselves in. Well, I would suggest to you that the bottom line is the one that we have been petitioning for all along. It's the one that the consultant's report identified. It's the two-site model. And because the two-site model ensures us that our citizens are not put unreasonably at risk, that they have reasonable access to healthcare services. But it's what's within that two-site model, ladies and gentlemen, that we're really going to have to evaluate. Is it the bricks and mortar that we need to retain, or is it the services that we presently have that we must fight for? Because those services lead us to the next issue that represents our bottom line, and that is the specialists who deliver those services must stay in our area. Now, for the most part, they're a pretty humble lot, and they're pretty uncomfortable being up here. But I think if you ask them personally why they have stayed for this long, it's only because of you, ladies and gentlemen, because this community has demonstrated its support for them, and we must continue to do that. Without our specialists remaining here, without the services that they deliver remaining here, then we cannot expect to build a bridge to our new health campus sometime in the future. We will have forfeited that opportunity because we feel very strongly that once they and the services they deliver have left, we will never be able to get them back, ladies and gentlemen. So the time is now. So as I said, when Rick brings us this document, we will have to get back together again and look at that. we also need to look at where do we go from here. We can expect that we will have to put up with the degradation of our health care services, just as every other community in this province, I guess, is expected to put up with. But again, I say that's on the short term. On the long term, we need to have a plan to move forward with our health campus. That plan needs to be born locally, but it also needs to be endorsed provincially. The way it must be endorsed provincially is where our politicians need to come into this picture, ladies and gentlemen, because we are being asked to play a part in this financial crisis. And make no mistake, it's going to cost us more in the long run, personally, to access health care services. But it seems to me that any government who is asking its citizens to go through such a significant belt-tightening exercise must also quickly come back and to give us the hope that our future dreams are going to be able to be realized on the long term. And that's the commitment we seek from the provincial government, and that's, ladies and gentlemen, what we need our politicians to fight for on our behalf. And ladies and gentlemen, I know that we have the capacity in this community to make that project happen, to make it so that it's irretractable when the time comes and the money starts flowing again, that we will have furthered that project just through our local initiative, commitment, and drive, and our ability to do that. And in my dealings with Rick here, I echo Glenn's comments that Rick, I believe, has been very candid with us in our dealings with him. I believe he's been honest. I think he's a good administrator, and I think he's going to help us to realize our dream over the next few years. So I can tell you, ladies and gentlemen, that we have much work to do. We have much work to do together. But don't despair, because this community will get the job done, and this community will have the support from the West Kootenay boundary. We do need to reach out beyond our boundaries to all of the communities in our area, not only the ones that are serviced by Kootenay Lake Hospital, but also our neighbors in Grand Forks and Castlegar and Trail. And we have to stand united and put our rivalries aside and retain them only for sporting events, ladies and gentlemen. We need to speak as a region. Now, if this doesn't occur, our rural way of life is going to be threatened. And if we find that our hospital services are being degraded to the point where we feel that our citizens are being put at risk, that is nothing short than a full-scale assault on our rural way of life, ladies and gentlemen. Now, last fall, a number of us got together and we drafted the makings of a community health care strategy. And that's a document that could map out what we could achieve locally and how we could get there and what each of us could do to potentially be involved. And I would suggest to you, ladies and gentlemen, that we need to complete that strategy and give it to you so you can understand where this community and this region needs to go and how you can be a part of it. and how our local and regional government needs to come together and assist us by coordinating our initiatives towards better health care in the community in the Kootenays. And it really is a role now that has to fall to our local and regional governments. And I must say they have been working very hard with us over the last 18 months. But now that we no longer have a local health council, it really devolves to local government to assist us to coordinate our role and coordinate our needs and get them on the table in this huge region, and allow us to be more inclusive and allow us to carry out the work that needs to be carried out. So I look forward to getting back together with you and having a dialogue with you when Rick brings us this document, and when our strategy is to the point where we can share it with you, and maybe we can put it in the daily news so you can see where we think we need to go. In the meanwhile, keep informed, keep your spirits up. If you have the will, get involved and support us any way you can. Thank you very much.
I'd now like to introduce Dr. Jim Noiles.
Thank you. I have been a family doctor in Nelson for just over 20 years now. I've also been chief of staff at our Nelson Hospital, head of the Department of Family Medicine, and head of our perinatal committee. I've practiced anesthesia services for this length of time and have delivered countless babies at our hospital since my arrival. Now, I say that because I feel that I really am in a position to speak quite clearly and accurately as to what I feel are accurate assumptions about our community's healthcare needs as well as our region's healthcare needs. Not only for obstetrical services and anesthesia services, but for, in general, our core services. I've been given 5 minutes to speak, unless Drew lets me go over. Throughout my short talk, my message will be very clear. It is essential that we maintain our core services at the Kootenay Lake Hospital. Now that statement is made not only for the benefit of all the citizens and patients in our Nelson catchment area, but also for all those citizens throughout the entire West Kootenays. I'm sure we've all been watching the television and reading the headlines of the newspapers. Gordon Campbell has repeatedly stated that patients come first. This is only achievable if core services are maintained at Kootenay Lake Hospital. Now, I certainly agree that change is needed, and I'm very aware of the financial constraints that our region and our province finds itself under. However, this change can be achievable within those constraints with the two-site model based in Nelson and Trail. That would allow for core services being provided in each community with seamless coverage and cooperation. This will ensure that patients come first. In reality, this has been evolving over the last several years. As many people here may have experienced firsthand, with the general surgeons in Nelson and Trail alternating weekend call. This has gone on for the past several years, and this has enabled us to maintain our highly qualified general surgeons within the West Kootenays and has prevented burnout and prevented them from leaving the area. This is evolving through the other services, but needs to evolve more fully to all the services. There is a nationwide, and as you may be aware, a worldwide shortage of specialists. Just to give a very current representation of where we are at, Nelson has both a fully trained obstetrician as well as a fully trained general surgeon who are ready to commit to long-term practices in Nelson. Anesthetists, surgeons, an operational ICU with internists, laboratory, X-ray, pediatrics. Everybody is interdependent and all must be available. These all must be maintained if we want to continue to offer labor and delivery services to the patients of our region. I could list countless testimonials as to the reality of these situations. These happen. Is it appropriate to attempt to transport patients in advanced labor with complications? In reality, this would translate into a minimum of a 1.5-hour delay, allowing for summoning an ambulance, stabilizing mother and baby, allowing for the drive to another center, travel through our geography and through the barriers that our weather throws at us adds to that time. Would that be acceptable for you or me or for your family? No. Unfortunately, the reality of the transferring of high-risk obstetrics is that this is going to continue as it currently is the high-risk obstetrics is all transferred to the major tertiary care centers in Vancouver and Calgary and elsewhere. And that's going to happen irrespective of any reorganization within our healthcare district. And that's because the West Kootenays will never have the resources to deal with the markedly premature infants. And all those babies are the ones that are transported. All other situations and emergencies are well handled by the core of specialists that exist in Nelson and Trail. In summary, is it appropriate patient care to offer low-risk obstetrical services if there's no capacity for backup or intervention within 1.5 to 2 hours because of the lack of core services? We must maintain core services. We must remember that patients come first. Thank you.
Dr. Phil Malpass.
Thank you. It's a hard act to follow, Dr. Noiles. You've actually learned a lot this evening in a short time. You've been a very patient audience, and it does take some time to assimilate such a complex issue and put a perspective to it. And I've been thinking about this for about 18 months now. So I've had a lot of time to think about what I'm going to say now. I've been through the health campus debate and the excitement and all that went with it, and developing the capacity within which a health campus functions and what services it might provide, and trying to learn through surveys what is our desire of our public and what is the services they see and deem important. What is Medicare, and what in fact is our expectations from Medicare, and what are our responsibilities? What is the Canadian Health Act that Ralph Klein keeps on trying to fly under, so to speak? Well, this is one man's perception, and if you can bear with me, I'm just going to read through a wee bit here, because I've kind of distilled this morning as I drove in to work, because frankly I couldn't quite get it to paper until today, and I'd managed to get this 5-minute presentation, and so I'd like your patience and just to listen carefully to a few points which I've tried to distill philosophically where we're coming from here, and I think it may help you put together what the other speakers have really so eloquently presented to you tonight. Medicare, as we understand it, was first introduced by the Premier of Saskatchewan on the eve of an election in 1944. The bill did not save the fortunes of the then Liberal government, as Tommy Douglas of the old CCF party came to power. However, on January the 1st, 1947, his government implemented a provincial health insurance plan, the first of its kind in North America. The plan was to be universal, so it covered every resident in the province, and it was compulsory so that every resident was required to participate and to pay. It was comprehensive in that it included essential services provided by the hospitals of the day. In those days, of course, it was $5 per person per year to a maximum of $30 per family per year. Even at that time, the Saskatchewan public not only accepted the cost, but embraced and welcomed the services. public pressure quickly mounted across Canada and other provinces until a federally administered plan was implemented. There have been many changes to our Medicare over the years. Probably one of the most important was indeed the 1984 Canada Health Act, to which Canadian provinces, until the present time, have been held accountable. In addition to the conditions in Tommy Douglas's first plan, the Health Act defines two additional. One, portability. It is assured that Canadian citizens of healthcare services would be having the same services available in other provinces. And finally, public administration, such that government-appointed administrators would manage this plan. It passed unanimously, which was uncommon those days in the House of Commons, and has been depended upon by our Canadian public ever since. This plan has been zealously defended by Canadians, and it's coveted by our partners south of the border. Since the 1990s, increasing financial instability and pressures resulted in a more recent national forum which concluded the following. Number one, that our healthcare system really is fundamentally sound, and I think most of you agree that it is sound. Secondly, that there's sufficient money spent on healthcare. And thirdly, that the system could be improved and there is ample evidence that the resource could be used more effectively. I believe in these conclusions, but the healthcare reforms suggested have never been truly implemented. Unfortunately, our current experience is not a result of healthcare reform, but a process driven solely by fiscal restraint. The results of the fiscal restraint, rather than the healthcare reform, are evident in the scenario that we may experience in Nelson. Those of us in healthcare in the West Kootenay, and specifically Nelson, have been on a roller coaster ride recently. We were on the brink of realizing our health campus project. This idea was fostered and brought to fruition by our late administrator, Mr. George Gillies, supported by Debbie Zeben and the Nelson and Area Health Council. It embodied many of the principles that I personally believe were essential for the true health reform we desired. This cause was championed further by our then MLA Corky Evans. As community members and healthcare professionals, we began to function with the mentality of the health campus reforms, even as we experienced severe nursing and medical shortages. The concepts of collaboration, of health promotion, and disease prevention drove us to look for human resources from within. There are many examples of this in Nelson's current system. Our position to generate positive changes in healthcare is demonstrated by these examples. When our ICU staff last summer became exhausted from overtime and called back to extra shifts, our hospital administration commissioned the training of 5 ICU staff members. This training program, generated by one of our senior nurses, Lori Verrigan, in concert with BCIT, resulted in an active, working, competent staff within weeks. We filled the gap. As we dropped from 3 internists to 1, with administrative support, we were able to attract an advanced practice nurse to be a nurse practitioner in our oncology or cancer program. This same nurse practitioner, Cheryl Willen, is collaborating on a new project that is supporting the care and investigation of hepatitis C patients receiving treatment in the region. Sustainable support in an intensive care unit is not feasible with a single internist. With another innovative solution to the problem, a family physician from Nelson, Dr. Anna Reed, completed specialty training in a tertiary care hospital in Vancouver in emergency and critical care. She's returned to Nelson and she complements our internal medicine service and supports our ICU. We have specialty care practice nurses in diabetes who run an insulin pump program providing special service to our type 1 diabetics. This program is the only one of its kind between Calgary and Vancouver. We have referrals throughout the Kootenays. These nurses provide supervision to over 1,500 diabetic patients. Nelson's ICU staff Nelson's ICU staff nurses provide specialty care whose quality is no different than in any tertiary care hospital. They could work anywhere. They are independent, caring, and compassionate professionals. What we lack in manpower, we make up with a commitment. We look for support from within, and we expand our capacity through innovative partnerships. This has been the Kootenay way. We're geographically far from tertiary care help, weather conditions that limit our access, particularly for air transport. They've necessitated that we create local competency and independence. By necessity, we've developed collaborative partnerships, and through these, we've been able to develop programs and sustain the capacity to look after our own citizens within this region and maintain a high retention rate in the West Kootenay. We recognize specialty services, angiography, angioplasty, spinal cord injury, among others, must be transported to tertiary care centers where specialists are available. I also recognize that these tertiary care centers are overburdened. For example, on Monday, as I attempted to transfer a patient to St. Paul's Hospital, I was informed they had 30 patients in their emergency room. There was no expectation of an available bed, and that wouldn't be for an indefinite period of time. It's obvious that we need to maintain our skills, our services, and professional capacity in Kootenay Lake Hospital. Any loss of the services will compromise care to the entire region. There is presently no strategy that provides medical care in the absence of the existing core services in Nelson. Budgetary constraints cannot justify the elimination of these core services to our population. This includes people living with diseases as cancer, diabetes, and heart disease. There is no other place within the current system with the space, resources, and personnel to direct their care. If not here, then where and how? This message has been presented to our CEO, Murray Ramsden, to our Chief Operating Officer, Rick Riley, to our MLA, Blair Sufferedine, and on Tuesday evening to the medical chief of our Interior Health Association, Steve Hardwick. I think they understand the message. I believe we've made our points. But there's no doubt in my mind that we're going to experience interruptions in some services. We can certainly expect reduction in beds in our facility. We're already strapped at 43. We used to be 120. I recognize that this is the ministry's time-honored tactic to reduce utilization by reducing our bed availability, essentially reducing the size of our hospital. We need a collaborative effort on the part of healthcare professionals and clients. That's you and I. Rather than resisting the change, I believe we have to functionally embrace it. There are efficiencies we could gain, and by doing so, we could protect some of our services. If patients coming to the emergency room for infusional treatments and other therapies could be taken out of that setting, there'll be more beds for those who are critically ill and need emergency services. If you in the community utilize our emergency room for true emergencies and consult otherwise with your family physicians, there'll be less pressure on our emergency room. If we as a society embrace better health habits with a more preventative and wellness strategy, we could reduce hospital admissions. Interestingly, one Stanford health study recently looking at risk factors for heart disease found there was a 40% reduction in admissions from heart disease, the most common cause of our admissions, simply by risk factor being modified in those individuals using a wellness and prevention strategy. These things work. Why aren't we doing them? Diabetes. Diabetics should go to a diabetic daycare center to improve the quality of the diabetic control. We have one of the best in the province. Asthmatics should attend programs to manage their asthma in outpatient settings. We have a respiratory technician, Keith Houghton, who runs such programs, and I've already seen a dramatic fall in the admissions and emergency room visits from asthmatics resulting from this. Individuals living with cancer are educated and supported to adopt self-care measures to minimize the impact of these difficult but anticipated treatment side effects from treatments like chemotherapy. These examples are successful because there's strong collaboration and expertise exists between the specialist, family physician, the registered nurses, the client, and their family. We all need to exercise more, eat less, or at least wisely, and stop smoking. There are many things. There are many things that we could do that would reduce the pressure on our health services. This will greatly assist us in reducing the demand for them. We do need to work together functionally. All the people on this stage care about healthcare and its delivery. Don't be frustrated with the group, but rather express your concerns and ideals, suggestions, and let's have a true health forum. Let's look at our own health reform rather than asking governments to look after this for us. This embodies the spirit of the Nelson Health Campus. If Nelson shows such initiative, I'm confident that some winter, in the not too distant future, we will get our health campus built. We will move in with our existing programming, supported by a public proactively engaged in their health care, and set an example for other rural Canadians about community empowerment, even with the limited resources in stressful times. Thanks for your attention.
I'd like to thank all our panel for coming out tonight and providing us with that information. I really appreciate the efforts that everyone's gone through, and I think it's been very informative. Thank you. We're setting up 2 floor mics here, and we're going to alternate between them. So if you have questions that you'd like to ask any member of the panel, please line up at the microphones and we'll take as many questions as we can. Again, please remember that you have 30 seconds to make a statement or ask a question. We do that not because we're trying to limit what people have to say, and we know that these are important issues, but simply so that we can get as many people have their questions answered in the time that we have available. So please try and respect that. So I think we'll start on that far side there. Go ahead, sir.
Thank you. My name's Robin Sherbo. I work for the Ministry of Transportation. We've seen brutal cuts in the public service in what we've been told to save healthcare and education. So my question is, and it could be directed to any of the panel, is are we going to see privatization of healthcare in order to save cost? The limited dollars we have, I don't want to see our services privatized in order to try and save money when it's going to cost more in the long run. Thank you.
Thank you. Mr. Riley?
Well, I think the answer to that's reflected in the legislation that was recently passed in the provincial legislature that, in fact, yes, I think private health care is a good possibility in the future in this province.
Okay, I'm not sure we have a question here. Do you have a question?
Yes, we do.
Okay.
The grannies are coming, hurrah, hurrah! The grannies are coming, hurrah, hurrah! We're here, we're here, we're here, you see. And we all know nothing is free. As I go gasping through the door to find ICU is no more. And at my side, the pregnant one finds babies here are no longer done. And Harvey's leg hangs by a thread. It's gone for sure. Oh, such a dread. Across the country, through the snow, in search of health care, we must go. The grannies are raging, hurrah, hurrah. The grannies are raging, hurrah, hurrah. and quietly sitting. The grannies are raging. Hurrah! Hurrah! Yay!
And that was longer than 30 seconds, but I'm afraid of them, so. And I do. On this mic here, please.
Thank you. That's a hard act to follow. My name is Colleen Driscoll. I'm a registered nurse at Kootenay Lake Hospital. I'm a hands-on healthcare provider. My main concern is not money, but safe patient care. My question here is to Mr. Riley, and thank you for coming in this night in the snow. It's great to see all the panel. I appreciate you all being here. My question is, after this decision is made next week, how much leeway is allowed? And who makes the decision? And if we, as I say, patient safety, and I know you guys are concerned about patient safety too, Mr. Riley, don't get me wrong, but...
Okay, can I let Mr. Riley answer that question?
Yeah, thank you.
Thank you. Go ahead, Mr. Riley.
The decisions, what's coming forward is a proposal in terms of services to be provided in communities. And it's being put forward to get responses on issues such as you just raised. Is it safe? Are the assumptions correct? The decisions will be, as I indicated, taken back at an administrative level, brought into the process for the Interior Health Authority, and it will go then to the board of the Interior Health Authority. No decisions will be implemented, however, until the provincial government receives the document and endorses it, because the nature of the changes are so significant that they need to understand what it is being implemented across this province and in the Interior Health Authority. And the period for review is a period of about 4 weeks.
Okay, next question, please.
I don't want to mislead you to think the process that's being put forward is, to use the phrase, meaningful consultation. It is an opportunity to see proposals and to judge them and challenge them. It's not starting from the ground and working up through the system with a proposal on how to operate the health system in the future. It's a very expedited process forced upon us by the policies of the government to be ready for April 1st.
Next question.
My name is Wendy Lawrence, and I have Ehlers-Danlos syndrome, and I require physiotherapy twice a week at the Kootenay Lake District Hospital. And I don't want to see our hospital continue, I want to see our hospital continue to provide the high quality services that it does, as I depend on this for my own quality of life. I don't want to be forced to move away from a community that I enjoy and I'm employed in, because I can't afford to pay for the physio in the private sector. So let's have Mr. Campbell keep his promise to put the needs of patients first and keep the Kootenay Lake District Hospital so that I and others can enjoy our quality of life right here in Nelson.
Sir, please go ahead.
Mr. Riley, my name's Bill Baird. A year and a half ago, my 2-year-old son was diagnosed with leukemia. We were told at Children's Hospital in Vancouver that we were going to be there for 8 months on his initial diagnosis. We were allowed to return to Nelson in 3, knowing that Carrie Fitzsimmons was here, knowing that we had an oncology place here. Thanks to the citizens of Nelson and the fact that how well outfitted our hospital is, we've dealt with the last year and a half with 2 more to go. If we lose that, I don't know what's going to happen to my family. We'll probably have to move to closer to a facility. That's about all I don't know. This means a great deal to me. And I think that if our elected officials worked half as hard as our doctors in this community, we wouldn't be in this problem.
Go ahead.
I'm Sandy Gilfillan. I'm president of the Nelson Downtown Business Association. I grew up under the assumption that government came from the people, not from above. I don't know whether that's wrong. But, you know, Mr. Riley, the message I want to bring from the businesses in this town, and I've talked to many businesses, they are 100% behind having a great healthcare facility in this town. Not good, not adequate. We want great because we're great people here, and we will work for it. But the other thing is, I would not want to be in your place. I would not want to ever have to put a $sign in front of anybody's life.
Sir?
Hi, my name is Ernie Dion. The last time I was here, I spoke in twofold capacity. Tonight, I'm only speaking for myself as a private citizen. I want to thank Dr. Malpass and the other doctors and the board for being my voice and standing up and standing firm for our medical needs in here. As Dr. Malpass is an internist, and he sees the patients which would require, and he does. I want to thank every one of you that you also see what the need is for us in this community, in this region. A heartfelt thank you, and still be my voice for me, so those jackasses in Victoria can hear.
Go ahead, sir.
My name is Don Crichton. I live in Nelson. To start, I'd like to refer to Mr. Howard Lyman, who wrote the book Mad Cowboy and was a large-scale cattle rancher. Through his own studies and the experiences of others, he learned that meat eating led to many human illnesses. My question, do any of the expert panelists present here accept basic, meaning 95% more or less, vegetarianism as part of a healthful lifestyle?
Okay.
I like a hamburger as much as anyone.
That's a hot potato.
This is clearly a question for Dr. Noiles.
Can you just remind us when that next meeting is?
Okay. I don't think you're going to get an answer on that one, sir.
Thank you.
Thank you very much. Ma'am?
Good evening. I'm Debbie Zeben, a concerned citizen. What I'm about to report out on is probably going to surprise people, given the outstanding and absolute tremendous commitment that we receive from our health professionals. The West Kootenay Boundary Service Area ranks below the provincial average on life expectancy, infant mortality, and potential years of life lost. In fact, the Provincial Health Officer's report ranks our region 17th out of 20 on health status. Our overall ranking in the province is 11 out of 20. We're in the bottom half, folks. The question I have is for Mr. Riley, and I wish Mr. Sufferedine was here this evening. First of all, I'll share Mr. Sufferedine's question with him, or with you, and perhaps someone can take it back for him. What are the ways that the communities of the West Kootenays can work with to improve our health status? And Mr. Riley, how will health reform help our communities to increase their life expectancy, decrease infant mortality rates, and address the potential years of life lost in our communities?
Well, thanks, Debbie. I think the issue is in many categories, the West Kootenay boundary is funded on a per capita basis substantially more than in other areas in this province. So the real question is, what have we been doing with the money that's been coming into this area over the last generation? that we have such poor results. So I think it is an opportunity to look at how we're using our money. Now, and I think there will be opportunities at looking at new ways of delivering service as we move forward. But in the short term, I think the answer is the focus is on financial restraint, and that isn't being addressed by this reform. I think that will come later, once we go through this very difficult period we're about to face.
Go ahead.
Hi there, my name's Tina Coletti. I've been a registered nurse for 16 years. I was raised in this community. I spent 12 years away practicing in a small rural place in Revelstoke. I am back. I'm very glad to be back. But my question is to this entire panel, but more to absolutely everybody that is here in our community and our province. It is, what are you as an individual prepared to do to individually preserve the healthcare services in your community? Are you prepared to accept the financial model that this government and Mr. Riley has communicated that is what they base healthcare on, is a financial model? So the BC Nurses Union has produced an upcoming future endeavor if you care to participate. We feel, as Ms. Zeben has just questioned, there could be more deaths happening in this province. We have included the phone numbers of your MLA, Mr. Premier Gordon Campbell, the Finance Minister, who is ultimately responsible for the financial
Ms.
situation.
Coletti, do you have a question for the panel?
The question is,
Okay.
and for this community, what are you prepared to do, and call them?
Go ahead.
I'm not going to answer that question specifically, and I will pass it down the board, but I want to backstep just for a moment. Deb, are you still here? Deb Zeben? On behalf of the community, we really have to thank you for all the work that you've done and all the help and support you provided us. It's been absolutely tremendous. And in your role in the North Nelson Area Health Council, in your role in directing City Council, Regional District, the Foundation, the Chamber, all the groups, I tell you, everybody give her a hug on the way out, because she's one heck of a lady.
No more answers.
I think just to perhaps repeat a couple of things that have already been said. We have the capacity in this community to develop the health campus a long way, but we really need the endorsement of the government for it very quickly, so that we can, through these tough times, advance it through our own citizen willpower in this community. And that doesn't only mean raising funds for it. It means taking the innovative steps to develop the project, the various components of the project, some of which, as you may know, were designed right from the beginning to be privately funded. The assisted living component, for example, the medical practitioners component. There are many avenues we could explore. We have had preliminary discussions with Selkirk College, for example, to see if in future they could look at providing health-related programs that would complement the campus and be delivered out of the 10th Street campus where Selkirk operates now. Those are just a couple of examples of what this community is prepared to do to realize this vision.
Okay, I think we'll move on to the next question, ma'am.
Good evening. My name is Nancy Banks. I've been a lab technologist for 27 years, and many lab managers before me at the Kootenay Lake Regional Hospital have come to the area where we work in diagnostic servicing, thinking how can we approach a cooperation between the sites in the West Kootenay boundary.
And my question is to Mr. Riley, where he does talk about rivalry. We have tried cooperation. We have been at that stage. And as I say, my tax dollars are just as important as everybody else's. We don't want to have duplication. But what's going to happen when he decides, or the board decides, on where diagnostic services are going to be? Do we get to have a choice in it? Can we say, we will do this, or will we be told what we will be doing?
Okay. Mr. Riley?
There'll be an opportunity to have a voice in reviewing the proposal. I'm not certain that in diagnostic services, and particularly lab services at this time, are going to be specified because, in fact, Interior Health Authority is looking at laboratory services and their delivery from a macro-regional point of view, not just within Kootenay boundary. And the decisions will not be forthcoming in the first stage. But there will be an opportunity for you and your colleagues to have input and comment on it as it's presented in the next 4 weeks.
Okay. Next question, sir.
Hi, my name is Rob LaBelle. I'm a registered nurse at the Victorian Hospital in Caslow, and I'm also the Green Party health policy advocate. At the hospital in Caslow, we have a small emergency room, which we deal with everything from small cuts and bruises to car accidents to cardiac arrests. And in the case of cardiac arrests, we have the golden hour, which they're stabilized in our hospital before we transfer them down to Nelson. Now, in the last election, we heard the Liberal motto was healthcare when you need it, where you live. And perhaps their new credo should be healthcare if you can afford it 2 or 3 hours away from where you live. And I'm asking... It seems like the government and Mr. Riley are putting dollars in front of lives, and the question I have for you is, what assurances can you give to the people of Caslow, New Denver, Lardo, Meadow Creek, all the outlying areas in these communities, that they will receive proper health care that does not threaten their lives and their good health?
Okay.
The health plan is going to, that I understand is going to come forward, is going to try and address that within the parameters. I haven't got the details of how that's going to be achieved. You'll have to assess it yourself when you see the documents.
Next question.
Brian Zacharias is my name. I'm listening very closely here, and I'm being told that there's only X number of dollars available, and that's pretty firm. You know, if we whine enough, we're not given any assurance that there are going to be more dollars available. So, you know, I've had very good health care in the hospital here. I've had 2 surgeries, and it was excellent. I got to have another one. I'm on a waiting list right now. The point that I want to make is this is being run like a corporation. It's, the heart and soul is being taken out of it, and it's a dollar and cents thing. And I just want to ask perhaps Dr. Malpass, he was the man there who gave some indication of what we have to do in the event of this decree coming from Victoria. And it's going to be a decree, and it's going to be cuts, I'm pretty certain. So, you know, we need some concrete plan in the community rather than a feel-good
Can you
plan.
ask your question, please, Brian?
What are the contingency plans when this decree comes down, or
Okay.
are there any?
That's a very good question. That's the $64,000 question. I must say, when Drew initially proposed this meeting, I had some apprehension about having to attend the meeting without the answers because we hadn't properly framed in enough information to provide them. And I knew this question would come up. Thank you for asking it. Number one, cancer chemotherapy patients are going to get their chemotherapy on time. Those people who are coming in for rheumatoid arthritis infusional treatments in the emergency room are going to get their treatment. People who are coming into the ICU and need critical care are going to be looked after. You're dealing with professional groups. You're not dealing with people who are uncaring or not showing compassion. This is not going to happen like that. So I think it's important that, as anyone in the room, you can have the assumption that we're not going to desert our posts. I don't care what they do.
sir.
My name's Rob Shamhart. I was born in Nelson. I was born in that hospital. I lived 3 blocks from that hospital. I was with my parents, both, when they died in that hospital. Now, I might, healthcare is my profession. Because of privatization, all indication is I will no longer live in Nelson. It saddens my heart. But my question is, if you need to not take up room needlessly in a hospital, what plans are there to provide quality, professional home support for people in their community, which saves money?
I'm going to give you an indication of what is in store for home support, because this is one of the areas that, statistically speaking, the Kootenay boundary is very well funded on a per capita basis. And in the Okanagan, they're establishing, well, they have established a certain level of service, and they're providing substantially less service than we are now having in our Kootenay boundary. So things such as bathing and food preparation may no longer be provided. There's going to be every attempt to make sure that basic personal care is still provided, but there will be a reduction in the nature of the services in the future because of the funding restraints that we now have before us.
Dr. Malpass?
Just want to point out one issue, and Mr. Riley knows of this because we actually spoke at rounds today, and our neurologist underscored this, Marianne Berry, that over the last few months we've had a number of patients in our facility who have had cerebrovascular strokes, and because of limitation in getting beds in rehab units in Trail, they've actually stayed in our hospital for up to a month and been provided the best possible service that could be given by our OT and physios, but it's not a rehab service. And then in December, we were informed that the rehab clinic in Trail was closed, and for all intents and purposes will remain closed. And that's a feature of this budgetary restraint that Trail's been placed under. So the region's being affected, and the services that we share within the region, and many of these are indeed shared, are being affected by these decisions and budgetary cuts. And as a result, the downstream of that is that those people who should be moved on into facilities where they're getting proper rehab and getting home stay in hospital. It's not good for anyone, and that's not where they want to be. And it's a reality. If we are cutting both the acute care and the chronic outpatient services, that this is going to create even more of a bottleneck. I predict that. So I agree with your question. I think it's a very pertinent one here.
As part of the change, there will be a movement towards developing supportive housing and assisted living developments in our communities. We institutionalize our seniors far more than most countries in the world. And there is a move to try and provide alternate living accommodations. Now this ties in with some of the concept of the health campus. It will require not-for-profit groups within your community to come together to raise the funding for the capital costs. And the earlier question about privatization, this is probably one of the areas where the door will be opened to privatization to provide this type of housing. But that's what is going to move forward in terms of providing alternate services. And it goes to the philosophy of this government of more individual responsibility, and that means more responsibility for the cost of your health care.
Next question here.
My name is Gwen Kalnick, and I work for mostly community programs providing support for mothers and babies in the first year, basically, of their lives. And we know that providing preventative support in that time period, it's extensively documented that saves health dollars down the line. And I would like us to, I like the way Peter's talking, I would like us to refuse to support core services and look at our preventative services as a frill and privatize them, because I think that's a huge, huge mistake, and it's going to cost us a lot of money down the line. And if we're, trying to save money now in order to, have to spend a fortune on things later on, it's absolutely ridiculous.
Do you have a question for the panel?
Well, I have a question, I guess, around what kind of community supports, like diabetic clinics and postpartum care, at-home breastfeeding support, all that kind of stuff. What's the vision for that? It sounds like that's going to be privatized, or that's the idea that the government is having.
Okay. Mr. Riley, can you answer that?
I can't answer the specifics at this time on that question, but we are, through this core review, what we are in is a core review process, looking at what services will be provided in each individual community and facility. And should this community decide what's proposed in the document should be altered and still achieve the same cost goals or spending goals that the government's laid before us, then it will be accommodated. There is that opportunity to have that input. But I can tell you in the short term, it's a lot of focus is on acute care and residential care.
Next question.
Good evening. My name is Cindy Sandevland, and my son was born at the Kootenay Lake Hospital. My dad's life, I could more or less was saved up there by Dr. Malpass and Dr. Seaman and Dr. Reed and some other doctors. And so I've had a really good experience with Kootenay Lake Hospital, watching the services he's been given and other patients there. Myself, I had experience at the Trail Hospital and certainly would never want to pit Nelson against Trail. I spent 5 days there. My 4th night, the nurse who was working on our floor was on her 8th night shift, and they couldn't get anybody in, and they were constantly calling, trying to get staff. There were people sitting in feces for a lot longer than I know any nurse would feel comfortable knowing about. And what they kept saying to me the whole time is, we are extremely short-staffed. We cannot staff this hospital. And I really wonder, has that been looked at fully in this review? And are you taking that into consideration, the fact that Trail runs a huge shortage all the time? Thank you. That's correct. Thank you.
The review is going to result in fewer beds in this region. There's no doubt about it. This region, in terms of most nursing positions, and except during times of high leave periods, is we have in almost every instance RNs and occupying all regular and full-time positions in Trail and Nelson. It's my understanding. It's the issue is providing adequate relief for the nurses to have their vacations and other forms of leave. To say it's being specifically addressed, no, it's not at this time. We're looking in the review, it's looking at what the services are. Following out of that will be then the staffing necessary to provide those services.
Okay, it's 8:30, but I know there's still a number of questions left, so we are going to continue on here for another half an hour to try and deal with some more of these questions. I do have to tell the people listening to Kootenay Co-op Radio that they're going to sign off now at 8:30. So thank you to them for joining us. And apparently there are some people who want to leave, so perhaps we'll provide them with that opportunity. But there are still people at the mic, and we were late in getting started, so the panel has agreed ahead of time that if there were still people with questions, that they would be able to address them. No. Yeah, okay, we'll continue on now. If you'd like to ask your question, ma'am.
My name is Marilyn Keith, and I've been a nurse at the Kootenay Lake Hospital for 30 years. For 20 years, sorry. I've been a nurse for almost 30. I've worked at different hospitals around the province and landed in Nelson and never to leave. I think that the nurses in Nelson, the majority of them are here because of spouses or the way of life. And today it was really upsetting to me to go to a U.S. recruitment meeting with a U.S. recruiter and have 20 of our specialized nurses show up really very interested in leaving this West Kootenay community. I'm really to the point where I'm really tired of government interfering with health care. Every new government that comes in, they have an idea of how to save dollars.
Do you have a question for the
yes,
panel?
Yes, I do.
Okay, thank you.
I need to know from Mr. Riley in particular, I don't want to put him on the spot, but now if we go to cuts in the Nelson area, we are going to lose nurses from the West Kootenay because they're looking towards the U.S. as a short-term fix. They can go down there.
Okay, can you ask your question, please?
Okay.
Thank you.
Oh, my question is that how are we going to be able to recruit nurses in an area of Trail where the employment is limited to what spouses can do in the future as we go? It's supposed to, the economic growth is supposed to be in Nelson, so the nurses would be attracted to this area, and we all know the heart of healthcare is with nurses.
Okay.
Well, I agree with you that the issue is retaining nurses. I think during the coming pressures we're going to be under, there will be every effort to ensure that there's to the degree possible minimized effect on and impact on nurses, to retain them in the communities and to retain them in our facilities. There will likely there'll be some adjustment because of possible downsizing in some facilities. There's no doubt about that. That's going to be part of it in order to live within the funding that's available. However, there will be every effort made to retain nurses within our community. The issue of how do we recruit nurses to Trail because they're married to Cominco workers, that's an interesting question. Cominco, the mayor of Trail phoned me to say, you know, that they've lost another 35 due to layoffs and 109 due to early retirements in Trail at Cominco. That's a very quiet reduction in the workforce happening in the West Kootenay, similar to what's happening in Nelson. It's a problem if that's what's going to happen. We'll have to come up with strategies in the future to address it. They won't be addressed in the role review that's coming in the short term.
Next question.
I just want to say thank you to the doctors in our community who are so very high caliber. They also saved my life. And if I had have waited till I drove to Trail, I'm afraid I wouldn't have made it. And I'd also like to say that September 11th changed the whole world, Mr. Riley. It changed people in the way they think about things, and it wasn't about the dollar. It was about people, it was about caring, compassion. And I don't see that in this government. I see seniors, the blind, everyday people. And it's not about caring that Mr. Campbell's showing them. And when things get to be
Ma'am,
corporate
do you have a question
run,
for the panel?
Yes.
Okay.
When situations get to be corporate run, I have to say, do you really think that's the best way to go, Mr. Riley, run by corporations, our healthcare?
As I said in my opening comments, I've worked in healthcare for over 25 years, and I have never seen the environment change the way it has now. I would though comment that with the present government and the present structure, if it wasn't me, it'll be somebody else. And what I'm trying to do is work to mitigate the extent of the cost effects on this community.
Okay, well, you've seen our community, and we are strong.
Okay,
we have a
ma'am,
high caliber.
you've had your question. I'd like to get on to some of the other people. Thank you.
Hello, my name is Paul Keelan. I'm a concerned citizen. I live out in Crescent Valley. My question is for Mr. Riley. I'm wondering if you could tell the people in this room and the people reading the newspapers later and how we can achieve the goal of yourself and the corporation listening to us, the people, instead of us listening to you and the corporation.
As I indicated, there's two processes that are going to have to occur. There's the administrative one where you talk to me about the concerns about specific health problems. There's a whole level of politics that I'm not directly involved in, and that's the role of your community and your community leaders to deal with those issues.
Where's Blair?
Blair works for the government, and I work for the Interior Health.
Next question.
My name is Eileen Bell. I'm a registered midwife who works at the hospital. And I wonder how many people in this room have shared the frustration and the sense of powerlessness that I have felt over the last few weeks. As I've waited to see where the leadership is in our community. I would expect to have seen that leadership from our MLA or from our community or from our city government. I haven't seen it. We need someone to aggressively take our case to the Ministry of Health, and I don't hear that Mr. Riley sees this as his job. So whose job is it, and who will take this role for us?
I'll do my best. About 18 months ago, there was a group of different sectors of Nelson put together, and it was representation from the city, the regional districts, the Chamber of Commerce, the Foundation, Nelson Area Health Council, the doctors and physicians. And over the last 18 months, we've tried to educate ourselves around what the local issues are. We have done our best to support all aspects of the current healthcare delivery system. They have been working very hard in the background on your behalf, and probably the communication to the public hasn't been as good as it should have been. But believe me, there is a group that has aggressively defended with both Mr. Ramsden, Mr. Dolan, and with Mr. Riley our position on healthcare and how passionate we are about it. We're going to continue that process as we move forward on your behalf, but as a community we have to come together and we have to define what's important. We have to stand and not move on it. And if it does mean that we have to take a step back, it's important that we keep the future in mind and we redevelop it as quickly as we can. We need your help, and I'll leave it at that.
Anybody else? Next question.
Mr. Riley, I'm a redundant government employee, but that's not why I'm speaking tonight. I'm speaking because I'm a grandmother, and I realized when I was moved to tears by Mr. Baird how hard it was for him to stand up and speak to you. I appreciate Dr. Malpass saying that the doctors will be here as long as they're needed, but they have to have a facility. Now I'm asking for a personal commitment from you. If Mr. Campbell says, put the patient first, what are we going to do for Mr. Baird's son to guarantee that the trust he places in a doctor now as a 2-year-old will be there for the same doctor 5 years from now? What can we tell him about growing up and being able to go to school here? And how can we guarantee that Mr. Baird is going to be able to see a grandson born at Kootenay Lake? What's your guarantee tonight to us? And I will ask Mr. Campbell the same question and Mr. Sufferedine the same question tomorrow.
And I have to tell you, there are no guarantees in life, but as long as they're good quality, as long as there's good quality medical professionals in Nelson, then that care will be provided. I can't tell you what the Premier has to say. That's his policy, and you're going to have to deal with him at a political level. I indicated earlier there will be a hospital in Nelson.
Okay, can we have another question?
Yes, I'm Effie Laurie. I'm a healthcare consumer and of Trail and our own local Nelson, which has been excellent. And I thank you doctors very much. But I'd like to ask the government, we've talked about the cuts in the future, but the cuts that they've already made to the health care, to the home care that they've cut, the chiropractors, the optometrists, the therapy, and on, the cuts that have been done, is that money going to be put back into our health care, or is it going into general revenue? There's thousands and thousands of dollars.
Unfortunately, I think that's a question for Mr. Sufferedine, who couldn't make it.
Good evening, panel. My name's Andrew Jones. I'm a local veterinarian here in town. It's beginning to appear that perhaps the pets of the community might have better access to health care than their owners. My question is for Mr. Riley. Our panel has said that, a consultant has said that ideally we're going to have a two-site model for healthcare delivery in the West Kootenay boundary. Our physicians have said that it's essential that we retain our core services. Yet, I'd like to hear a clear answer from you. I mean, what model do you favor?
Well, it's not what I favor at all. It's what is affordable and what the Corporation of Interior Health says can be provided, subject to reviewing the information that's going to be provided. It has nothing to do with what I favor, personally. It's Interior Health Authority. Will be a group of 9 individuals appointed by the provincial government to make decisions in healthcare for the entire Interior Health Authority.
Okay, the next question.
Mr. Riley, I'd like to raise 2 issues with you, if I may. First of all, I'm concerned with the concept that senior citizens who have planned their retirement based on the promise of the universality of health care are now being asked to take individual responsibility for costs when they've already planned and committed themselves to a retirement lifestyle. And I'd asked how that's being addressed in the increasing demographics of seniors in your health authority region. The second issue is almost every budget-cutting exercise involves an analysis of what assets can be sold. Can the IHA promise this community that its real estate assets, its physical plant, and its medical equipment that have been generated by the efforts of taxpayers and donors in this community will not be removed from the community, so that those assets are available to the doctors regardless of what cuts come?
To answer the second question first, yes, assets donated through fundraising efforts to the facilities in this community will remain in this community. That's a commitment that's been given to Mr. Lee by the Health Authority. With respect to the first...
Just before you turn to the first question, I asked about both taxpayers' contributions and donors. I'm talking about all the assets, the Mount St. Francis lands, the physical plants, and the other equipment that's in those buildings.
Well, the Mount St. Francis lands, of course, will remain in Nelson. But you have to, when you say taxpayers, the taxpayer of BC provided equipment where it was provided through the provincial government previously. Those items of equipment belong to the province and to the health authority. And We're all part of BC, and we all contributed to it. So it will go where the services and programs are finally decided to be provided. But definitely the equipment raised specifically for the Kootenay Lake Regional Hospital and programs there will remain there. And they won't be moved without consultation with the physicians and those involved in providing the service. Your first question was rhetorical in that I think I answered that question. The present government believes there's a strong sense that people must care for themselves and care for their own seniors. It isn't meaning, though, that people that have no supports won't have support in the future. There will be always care provided to those that need it, but there may well be requirements that people provide more of their own financial resources to have that care. It's just the changing environment. The government is saying they're not providing everything to everybody, and the assumption that was equal access for long-term care is covered under the Canada Health Act isn't valid. That's a provincial program that was put in place by previous provincial governments, and the present government saying it can't afford it to the degree that it was previously provided in a universal manner.
Next question, please.
Can I just add to that?
Oh, I'm sorry.
Just in terms of the equipment that we have purchased over the years, as Rick said, I was concerned, our board was concerned about the likelihood of that equipment being moved out of the community, so I did write a letter. I have received the assurance that that would not be the case, that equipment would not be relocated. I have every reason to believe that that will be honored. In the interim, our equipment needs list for this year that was given to us by the physicians and by the former Health Council amounted to $745,000. That's what we were trying to raise for this year. The reason for that is because we have to raise funds to provide for equipment that's all of the equipment that's valued at less than $100,000 must be paid for through donations. It's been that way for quite a few years, and that's just the reality of the system. We have, with this turn of events, we have asked the physicians to take that list and review it and ensure that we are still focusing on the priorities that exist today. We have postponed all purchasing until we receive this certainty and we can match that to the equipment needs. And that's one of the things that our board has to do besides raising funds and working with you. We have to do that to act as your advocate. With respect to the land, I think Glenn referenced that, I referenced that. We have been actively negotiating, if you will, with Mr. Dolman, Mr. Ramsden, and Rick to establish our right to move forward with the development of the facility on that land and to have some local control over the land. We feel that's a very important aspect of our ability to take action.
Go ahead.
I believe that our government, which is noticeably absent this evening and without opposition, is handing down dictates that are completely in opposition to the rhetoric that they provided prior to their election. With that in mind, I would like to ask each person who is here and each person at the table to refuse to adopt the rhetoric of the corporation, to refuse to continue to talk about the bottom line, and to remember that that in order to have a dialogue, the government needs to understand that people who are healthcare professionals will not be giving up the language of ethics, the language of morality, and the language of appropriate best practice.
Do you have a question for the panel?
Yes.
Okay.
Will you refuse to adopt the language of the corporation when you're talking about these healthcare issues in our area?
Any takers? We'll move on to the next question.
My name's Wanda Cameron. I'm a resident here in Nelson. I just have a question that came up to me as I was listening to all this stuff. It seems that most of the information that's available right now is only financial in nature, so I'll stick with that. One of the questions that I thought of was that in a smaller region where there's smaller towns, smaller populations, in general, things cost more. So I'm wondering if part of your funding formula that you're going to somehow create, I don't know exactly how this is done, but if that's going to be taken into account, because we don't have the same kind of high volume, that's why healthcare would cost more here. And you're saying per capita. If you give a per capita figure, yes, we're going to come out costing more. There is a base amount of money that needs to be spent to do basic operations.
Okay, let's let Mr. Riley answer that question.
My understanding is that there will be a factor allowed in the formulas for rural location, and that will provide slightly higher funding for rural areas than urban areas, particularly in acute care and in home support.
So slightly meaning?
I can't. I'll have to wait and see the documents.
Dr. Malpass?
One interesting accounting practice that the government is using is to compare us to North Vancouver. Now, I like North Vancouver, but if you compare us, it's really not fair. You're dealing with one of the most highly socioeconomic bracketed people in the country, one of the most fit and vigorous group in terms of their health attention to their needs, and self-motivated group. And so they are amongst the lowest utilizers of healthcare resources, and we're supposed to meet that target. That's the hard target. Not an easy thing.
Next question.
My name is Jim Reimer. I'm the pastor at Kootenay Christian Fellowship and also the chair of the Nelson Ministerial Association. And after what I'm hearing tonight, I'm wondering if prayer for the sick will become popular again. But my question is to Rick Riley. There is a sense of tremendous powerlessness and hopelessness in the community. And I think it comes because we feel that there's nobody adequately representing us. Will you give your assurance here tonight that you will adequately represent us with core services, meaning that you will find it not acceptable personally for us to lose any services that we presently now enjoy?
I will represent the interests of the community to the best of my ability, but I can't guarantee to the extent that you've just asked me to do so. But I will advocate for the Nelson community as I will for Trail and the balance of the whole Kootenay boundary to be fairly treated as any other area in this health authority.
Then could I ask the
Sorry,
panel, well,
Jim,
who
you've
would
had your
ask?
question. I'd like to get to everybody else too. Thanks. Next question.
Thanks, Chris. Mr. Lee, perhaps I could just ask a question in terms of where we should be devoting our resources as a community. Would it not be an idea to approach our council and ask them to move their thinking from the community facility to raising funds for the hospital? And given that we could do something like this, Mr. Riley, do you think that you could use that as an input to provide us with a better outcome if we could help fund our own facilities here? Yes,
Okay.
I understand that.
Let's
but
let these I'll let these questions be answered, okay?
Yeah.
Peter?
I didn't hear the first part. That
Okay.
you approached council, did you say?
What I was asking is, do you think it would be a good idea just to encourage our council to shift their focus from community facilities to getting us through this crisis in the next 4 years until the government is voted out, so that we can keep our core services, and then my next question to Mr. Lee was, can you use that as an input to say Nelson is prepared to go this far, we can make up the shortfall?
Okay.
Well, I think they're two separate issues. Certainly the rec center issue is another facility that this community is in dire need of. It complements our strategy that we want to implement around prevention and wellness, and so therefore it's complementing our goal of a healthy lifestyle. In terms of the funding regimes, they are two quite separate situations. The capital cost for the health campus was to be funded for the acute care facility, was to be funded 60% by the provincial taxpayer and 40% by the local taxpayer through all three regional districts in our area, voted and approved by the regional hospital district. So we had all of that funding in place, and that project has not been canceled, it's been postponed. In terms of considering how we can finance our way out of this dilemma, I've been thinking about that issue for several years. And I don't know how many of you were at our first meeting when Jean came to the front and said, gave us a donation and said, if the government won't build our health campus, then let's build it ourselves. But folks, that has generated a lot of donations that we are holding for a future day, so that we can complement the capital cost, but we still expect the two levels of government to pay for our new facility sometime in the future.
Sure, but you...
Okay, let's let the second part of the question be answered. Mr. Riley?
Well, Peter's answered the issue of capital, I think, and the other question I think you're alluding to is the community paying operating costs to maintain a certain level of service. And you heard the comments about folks already pay a lot through their taxes to provide health services. And if the community wants to consider that, I think it's something that they can go ahead and consider that. But once you go on a track of supporting operating costs of a substantial nature for a long period of time, it's very onerous. Well, it's certainly something that through your political leadership you could bring that forward into the health board. But as I said, paying operating costs for healthcare facilities is an onerous burden for local taxpayers, and it couldn't be donors. Donors, I don't think, could support it.
Next question, please.
Mr. Riley, the business model that we're given with this Interior Health Authority, you're describing as a corporation. Now, it seems that we are kind of shareholders of this corporation, and at the same time we're also customers. So I have a couple of questions that maybe you can elaborate on. Is one, a corporation in dire financial straits has certain obligations to its shareholders. One is to bring its financial, the fiscal pressures on it to some kind of solution that revenues equal expenditures or something. So what you're modeling for us is one is where, like a GM plant, where there's no more demand on cars, right? So the executive branch says, well, we're going to close that facility.
Can we get to the questions?
Okay, but I'm going to assume that we have demand on services as customers. It's not like demand and the service economy is declining. There is demand, and so how
can we?
How can you as
reaction to the cuts and the changes, and they're going to start to implement those. And there will be a phase during which, of course, we'll be informed as to what the changes may be so we can start preparing for them. But I think what I really wanted to say was that people who are out there who have loved ones with illnesses which are chronic and who are getting treatments, infusional treatments or chemotherapy or whatever you will, that they needn't fear that those things will not be available. I mean, there will be contingencies such that there will be a smooth, almost, if you will, seamless changeover to whatever the model will be in the West Kootenay at that time. And that none of us are going to react to a decision that's unfavorable by saying, well, we'll not continue with our care plans, our practice plans for our patients. We're professionals. We'll live up to our responsibilities to our patients. I guess the longer question you're asking, which is a more difficult one, is, well, what would happen in the community were we to lose the capacity to deliver that care in our community, and for specialists like myself or Carrie Fitzsimmons, our pediatrician? You are right. We could ultimately be in a position where we have no choice. If there's no capacity, for instance, an ICU or an oncology ward or a place for me to treat people who have those illnesses, and ultimately it's chosen by the health authority to move this to another site, then that may be impossible for us to continue in that model. But it's not going to be a risk to those people who are getting treatment now that they won't have access to it. And I think that's important to reassure our public. It was one of my anxieties about having this meeting this evening that we didn't have enough information to adequately inform people, to reassure them of what was that model and just how would it play out. And of course we'll have that information probably by about the middle of February. And then we'll have a chance for about a month of consultation with the members of this team that's organizing the change. And the implementation phase will start in April, but they won't be implementing immediately everything. The cuts will happen in a way which will be more or less fashioned to have the least impact on care. So I think that you'll see a response.
We want Rick O'Reilly saying there will be a Nelson Hospital. So ask a question that turns out, is there going to be a Nelson Hospital?
Graham, and the results you don't see till down the road.
Well, Dr. Malpass referred to a model, the Stanford Heart model of multiple risk reduction that showed a 40% reduction in hospital admissions over 4 years. That's pretty short-term benefit.
Well, I agree, and I'm not against anything that's positive like that, but what we have is a government that's giving me basically 2 years to get things in order, and then after that they would turn and look at that. Now, if there was preventative models that within, say, 2 years could generate savings of that extent, yeah, that would be something that should come forward now.
Could you tell us again what's going to happen with the Nelson Hospital?
I can't tell you today specifically what's happening. There will be a hospital in Nelson, and it will continue to operate. The question that's outstanding now is which services will be still in Nelson following the end of the review, the role review. And that's undetermined. The role review is going to be initiated in the next 2 weeks. There will be documents brought forward proposing roles for the various facilities in this region, this health service area. There will be opportunity for communities to react and respond, and then the decision will be made prior to the end of March.
That's not a lot of time. In what format will people be allowed to respond? Will there be a forum like this again, or will there have to be written responses? What sort of forum will that be, do you think?
Well, we're looking to community leaders to help pull those ideas together, such as the elected representatives, the mayor and council, and other interested people. Nelson has a very well-organized interest group in healthcare. It combines people such as Peter Lee here and the other gentleman, Glenn, that spoke earlier, and I think they would be one of the leadership groups in providing that feedback. And they can provide it in either written form, or I'm prepared to come to another meeting like this. I find a wide open meeting like this doesn't consolidate the ideas, so you get individual concerns, but you don't get an organized response to the proposal. So it can be in writing, it can be in interactive groups. I'm prepared to
Do you see some of the services that we now enjoy in Nelson as part of our healthcare? Do you see some of those services disappearing, or do you see some of those services being privatized? What sort of direction can we expect to see, after April 1st?
I think any opportunity, any alternative is going to be considered in the new era of healthcare in this province. That privatization is possible. Possibly some services in the short run may be lost, but that is true for all communities in the Kootenay boundary, not just Nelson. It's just the nature of the financial restraint that's being imposed on us.
Okay, thank you.
For Shaw Cable. Okay. All right.
Hello. We're just wondering if you have any comments as to how you feel the meeting tonight here in Nelson went regarding healthcare in our community.
Well, I still have a very heavy heart, and I have this feeling that things are going to be very grim for us, and I still don't feel uplifted as I'd hoped to be, and I think we have grave concerns as a community.
What does it mean to you and your family if we lose services in our community around healthcare? What services can you see being preserved, and what services can you see being sacrificed?
I see no services being sacrificed. In our family itself, we won't be needing the maternity one, but I feel as a maternity nurse that it's crucial to have that in our area. We're both becoming middle-aged, and I'm concerned that we're both crazy skiers. We need to have this place here in order to, in case we have accidents, to have emergency care here. As a citizen, I feel that the access I have, I know that if I get hurt, I can go to this hospital. My doctor lives out in the valley, and I can't just go to her when I want to if I have an emergency. I know I can go here and be treated here, and I think that's important now. And I don't think we could lose anything in this community. We deserve it, and we've got the best hospital in Canada.
Given that, what would you do in the government's place with the need for fiscal restraint in hard times in BC in recession?
Well, as a government, I would listen to the people. I would not make cuts in healthcare, and I would find another way of dealing with it and finding that the tax dollars they've saved on cutting physio, chiropractic, eye doctors, all those need to go back into healthcare. The services they cut with highways, forestry, and the dirt ministries need to go back into healthcare. If you don't have a healthy society, you have a very sick society. And do we want that? No, we don't. We need healthy people, and to have that, you need to have the government to help look after these people. Not all people are advantaged. I have an education. I have a fabulous job, but that's me. Not all people are as lucky as me.
Okay, thank you very much.